Hello, my name is Danielle Berg, and this is my Health Assessment 612 Physical Exam Head to Toe Assessment. This is my friend Yvonne, and she is my volunteer for the video. So to get started with, I gave Yvonne a gown. I did her height and weight. I did the Snellen test. I had her empty her bladder, and I did her vitals. So she has done all those things prior to starting the physical assessment. So first off, we're going to look at Yvonne's scalp and her head. Alright, and so we're just going to palpate her head, and it's normocephalic. There's no lesions. Her skull moves freely, and there doesn't seem to be any masses or anything anywhere in the skull. Her hair is also fine. It's soft and smooth. There is no patchy areas of baldness or any decreased hair growth. So next we're just going to look at her facial bones. We're just going to palpate her facial bones for any tenderness. And we're just going to do up on her forehead. And we're going to do her cheek area and her chin. Any uncomfortableness there, Yvonne? No. Alright, we're also going to do her temporal mandibular joint. And is there any tenderness in any of theirs? No. And can you open your mouth and close? And any tenderness with that? No. Great. Alright, next we're going to inspect her nose. And we have a pen light here. So we're just going to look at up in her nose. And we're just going to look at her turbinates in there. And they're nice and pink. They're not swollen. Her septum appears to be midline, and the hair growth seems to be appropriate in her nose and not patchy as well. And then we're just going to do the patency of the nostrils there. I'm just going to have you close one and breathe in, and then do the other side and breathe in. And any problems with any of that? Good. Next, we're going to do her eyes. So we're going to check her eyes in a couple of different ways and make sure that her eyesight is appropriate and her pupils respond appropriately. We're going to look at her eyebrows, and they are evenly dispersed, and her eyelashes are full and also evenly dispersed. We're going to check up here on her eyelids for her lacrimal apparatus, and that appears to not be swollen or tender or reddened areas there. We're also going to look at her sclera. And we're going to look at her conjunctiva, and that looks good. And same sclera and conjunctiva. Now we're just going to have Yvonne look at a point on the wall, and I'm going to have you cover your left eye and remove it, and cover your right eye and remove it. And I'm just looking at the pupils and to make sure they respond appropriately to the light. Next, we're going to do her fields of gaze, and we're going to check for any extraocular movement, any nystagmus, or any jerking movement. So I'm just going to look at my pen light here, Yvonne. I'm going to go up. And the other side, up. And up. And then we're going to check her consensual and direct pupil response. So direct and direct and consensual. Next, we're going to do the confrontation test. We're going to have Yvonne cover your left eye, and I'm just going to bring my and just have you face straight forward. I'm going to have you bring my finger in. Just tell me when you can see it. Okay, and then do the same with the other eye. And there we go. Good job. All right, now we're going to look at Yvonne's ears, and we're going to check the alignment and make sure that her ears look okay. And we're going to palpate for any tenderness or any lesions on both of her ears. And those both look fine. And then we're going to check and make sure that there's no skin tags or anything on either of her ears. Now next we're going to do the whisper test. And Yvonne, I'm just going to have you repeat after me if you can hear. appear to be intact. Now we're going to try and do the tuning fork and listen for the Weber and the Rin test, and we're going to check for bone and air conduction. So on the Weber test, we're going to just make sure she hears equally in both ears. And just tell me if you can hear equally. And then we're going to check the Rin test and check for bone and air conduction. Next, we're going to do the mouth, and we're just going to inspect her mouth. And we're going to look at her lips and her gums and inside her mouth to make sure everything looks good. So first, we're going to look at her lips, and her lips are nice and pink. There's no cracking or anything in the corners of her mouth, so that's good. Yvonne, if I can just have you open up your mouth and just say ah. All right. So we're just looking at her tongue and her buccal mucosa, the oropharynx, her tonsils, and her teeth, and to make sure it all looks nice and pink in there and everything looks good. We are going to have her stick out her tongue and just move to the left and then to the right. Good job. So we're looking for any skin lesions or skin cancer in her mouth. We also look at the uvula, and it's nice and midline and not shifted to the left or right, which is good. Now we're just going to do the gag reflex. And we're just going to make sure she has a good gag reflex. Yeah. Alright, next we're going to move down to Yvonne's neck. And we're just going to look at both sides of her neck. Make sure that everything is symmetrical. And again, there's no skin lesions or anything that we would be concerned about. We're also going to look at the jugular venous distension. And she does not have any, so that looks good. It looks like it's appropriate. We're going to just palpate her carotid and her thyroid and her trachea. Palpate carotid pulses there. And then we're just going to palpate her trachea and make sure that it's nice and midline. And then we're going to palpate her thyroid there. And that all feels good. Now we're just going to go through and check all of her lymph nodes and make sure that none of them are swollen or there's any big lumps or anything that we need to be concerned about. So we're going to start with the preauricular, and then we're going to move back to the postauricular. And then we're going to do the tonsillar here, the submandibular here, and the submental here. And then we're going to go back and do the cervical node, and the supraclavicular nodes here. We're going to do the deep cervical ones there, and the posterior cervical chain here. And then Yvonne, just have you put your arms out here, and we're going to do the infraclavicular, and then the axillary ones here. And all of those feel great. Alright, next we're going to move on to, we're still doing some of the neck, and I'm just going to have you do range of motion. So I'm going to have you tilt your head to the left shoulder, and to the right shoulder, and down to your chin, and back. Good job. Alright, and while we're here, we're just going to do the cranial nerves, and we're going to just assess to see if the cranial nerves are intact. So I'm going to have you clench your teeth, alright, pop out your teeth, alright, wrinkle your forehead, smile, and stick out your tongue, and then shrug your shoulders. Alright, good job. So all of those are intact. They look great. Now we're just going to do a quick sensation test with a Q-tip on her forehead, cheeks, and chin to make sure she feels evenly on both sides of her face. So we are just going to... And then how about yours? And your chin? Good job. Alright. Next, we are going to look at her chest and her lungs. So we're going to start on the anterior side. And we're just going to note any increased work of breathing. We're also going to look at her skin area, make sure there's no bruising, any skin lesions that we need to be concerned about. We'll also look at the rate and the rhythm of her breathing, check for any pulsations or any heavings anywhere. So now in the chest wall, we're just going to check for the precordium to see, and I'm just going to put my hand here. And I'm just checking to see if I feel any heaves or pulsating or any thrills. And then I'm going to also check under here, and I'm just going to check for apical pulse. And again, make sure that there's no heaves, thrills, and check for placement. And the placement should be the 5th intercostal space, the midclavicular line. If it's shifted over to the left or the right, that could mean the heart is enlarged and needs further investigation. Next, we are going to auscultate her heart sounds and make sure that they all sound appropriate to where they're at. So we're just going to listen to her heart sounds, and we're going to listen to the aorta. And we're going to listen to the pulmonic, which is at the 2nd intercostal space. And the Ernst point, the tricuspid, and the mitral valve, which is the 7th intercostal space, midclavicular line. And that all sounds appropriate and normal. Next, we're going to take the bell of our stethoscope, and we're going to listen to her carotid, and we're just checking for any groove. And we're also going to listen to her thyroid, and that all sounds normal. Next, we're going to do the tactile fremitus test, and we are going to have Yvonne say the number 99 as I'm checking for tactile fremitus. Go ahead. 99. 99. And again, we're just using the ulnar side of our hand. 99. 99. 99. 99. All right, good job. That all sounds appropriate. So now we're just going to listen to her breath sounds and make sure that they are all, her lungs are clear and we don't hear anything of concern, any crackles, wheezing, or rhonchi. And we'll listen in a systematic way. I'm just going to have you take some deep breaths in. To that lateral aspects, and we're going to do that systematically as well. So if I can just have you put your arm across your side, and I'm just going to take a listen here. Alright, next we're going to listen to Yvonne's lungs on the posterior side. So I'm going to have you turn around and face backwards. Alright, we're going to look at, we're going to listen to Yvonne's lung sounds on the back. And again, we're going to listen for any crackles, wheezes, or rhonchi. And we're also going to listen to make sure that her lung sounds are clear. And we're going to listen in a systematic fashion as well. percuss her lung fields on her back here. So we're just going to check the costovertebral angles. We're just going to percuss on there. And those will sound good. Now we're going to check for diaphragmatic excursion. We are going to, the normal diaphragmatic excursion is 3 to 5 centimeters. So Yvonne, I'm going to just percuss on your back. I just want you to take a deep breath and exhale. All right, and now I'm going to have you take a deep breath, and I'm just going to make a mark there and hold it in. And then I'm going to check the diaphragmatic excursion area. And so normally it would be about 3 to 5 centimeters, and that is good on her. And we would do both sides, but in the matter of time, we'll just do one side. Next, we're going to just do thoracic expansion. And I'm just going to place my hands here, and I'm just going to make sure, and I'm going to have Yvonne take a deep breath in and exhale. And I'm just making sure that her breath when she exhales is symmetrical on both sides. All right, Yvonne, now I'm going to just have you turn and lay on your back. So I'm going to get your little pillow there. All right, and then we are going to assess Yvonne's abdomen. So we're going to listen to all of her vowel sounds in all 4 quadrants and listen up to 2 minutes. If they are hypoactive or not active at all, then I would listen for up to 5. So we're just going to listen. We're going to do the left upper quadrant. And then we'll do the right quadrant. And then we're going to do the right lower quadrant. And the left lower quadrant. And Yvonne's vowel sounds sound good. So now we're just going to listen to the abdominal arteries. And first we're going to start with the valvular stethoscope on the aortic artery. And then we're going to listen to the renal artery on both sides. And then we're going to do the iliac artery on both sides. And then we're going to do the femoral artery on both sides. And those all sound normal. If you hear a dull sound when you're percussing, it's usually over an organ. If you hear tympani or a little lighter sound, it's usually air-filled, over an air-filled pocket. Now we're going to palpate the aorta, and we're going to just measure pulsation. And we're just going to make sure that her aorta is midline. And that is within normal limits. So now we're just going to percuss her abdomen, and we're going to check the liver borders, and we're also going to check the spleen and palpate for this with the spleen. So we're going to just go up the right intercostal margin, and we're just going to feel here for her liver. And we're also going to percuss. And then we're going to percuss over here for her spleen. And those both sound good. The spleen is on the left mid-axillary space and about the level of the 6th rib. So we're going to percuss for her spleen with her laying on her right side. Just turn to your right side. And we're just going to percuss right here on her spleen. And that sounds normal. So now we are going to check for, we're going to do some light palpation for any masses or anything that we might be concerned about in our abdomen. So you can just lay over on your back, and we're just going to do a bunch of palpation here. And we're going to feel for the liver there. And we're just going to do some deep palpation over the liver to make sure the borders are within 6 to 12 centimeters, which is normal. And we're going to check to see if there's any pain or tenderness anywhere. Any pain or tenderness, Yvonne? No. Okay, great. That's good. We are also going to palpate the right and left kidneys. And we're just going to put a hand under here, and we're going to palpate this kidney. And then we're going to just palpate on the other side here. And then we'll do our left kidney here. And those both feel good. Alright, now if you want to sit up, Yvonne, we're just going to check your, we're onto the musculoskeletal portion of the exam. And so we're just going to inspect her arms and her hands. And I'm just going to have you put these out as well. We'll also check your cap refill and make sure that that's appropriate. And her cap refill is about 3 seconds, which is good. We are also going to make sure there's no skin lesions or anything anywhere on her arms or anything. We're going to palpate her right brachial pulse and just make sure that that is within normal. And then we're going to do a right radial pulse and make sure that is okay. And then we're going to do the left side, and we're going to do the left brachial, and that feels good. And then we're going to do a left radial, and that feels good. And then we're just going to look at Yvonne's legs and her feet, and we'll do a popliteal pulse in the back of her knee here. And we're going to do a pedal pulse and a tibial pulse. And all those feel good. The temperature on her legs and her feet all feel normal. There's no edema in her ankles anywhere, which is good. I don't see anything there. Now we're just going to check her sensation again. Medical Q-tip. Make sure that everything on her legs and her feet, she feels evenly on both sides. So we're just going to, there, and you feel that, Yvonne? And then how about this? Yeah. All right. All right. And then soft or scratchy? And soft. And soft or scratchy? Okay. All right, good job. So those are just sensation tests, and so both of her legs, she feels the same sensation in. Now we're just going to do her reflexes in her arms and her legs. And so we're just going to check her brachial reflex. So I'm just going to hold you right here. And we're going to check your reflexes. And we're going to hold it here. And then we're going to do her knee. Wow. And then we're going to do this knee. And then we're going to do her Achilles tendon. And this side, Achilles tendon. And all of those appear to be normal. Last thing on our list is just to check her spine and check for any lesions or any masses on her spine. So Yvonne, I'm just going to have you hop down here. And then I'm just going to have you bend forward. And I'm just going to check her spine here and make sure that it's nice and even and there's no signs of scoliosis, any masses, any lesions anywhere. Here. And that all feels good. So her spine looks good, her musculoskeletal all looks good, and that concludes the end of my physical exam. So I want to thank you, Yvonne, for helping me out, and thank you for watching.